Hello, I'm Andrew Edwards. I'm an orthopaedic surgeon based in Yorkshire, and I have interest in lower limb orthopaedics and sports trauma, as well as being the Chief Medical Officer for one of the Super League Rugby clubs of our area. Sports trauma is a very wide subject and can be separated into a number of different categories. For example, we can look at things such as the head injuries. That's part of sports trauma, especially with the restrictions and the correct return to play protocols we now have. And then we can look at direct trauma, such as broken bones. And we can also have soft tissue trauma, which is more where I come into things, such as ligament injuries and cartilage injuries, as well as muscle overuse injuries, muscle direct trauma injuries, and many other sorts of injuries. The subject of sports trauma really is broad and does take a number of specialists of very many different categories to manage it. Some different examples of sports trauma would be, I mentioned head injuries. We have very specific rules now in rugby, both league and union in the UK and across the world, where if we see a questionable contact between the head of a player and another person, then we are obliged to bring that player off and do a proper examination away from the field of play. This has become a very important part of protecting our sports people. And the other sort of example might be that we can see someone who has been involved in a pivoting motion, either playing football, playing rugby, or just changing direction at speed, and they can buckle their knee, ending up with the type of injury that I do deal with frequently, being cruciate ligament and other ligament injuries. We can go on for a great deal looking at very different examples. And the other sort of thing you might see on athletics, for example, is the sudden tear of a muscle, as if someone was sprinting hard and got shot in the back of the leg. Of course, they go down very quickly, very painfully, and muscle tears and muscular tendinous tears are often very difficult for the athlete because it puts them out of action for a number of weeks and months. Some of the common causes of sports trauma are incidents where you cannot avoid the trauma, such as in a contact sport. Other instances of trauma are whereby actually it may be down to the preparation of the athlete for their competition, and an injury can occur if that athlete is not fully prepared. The various options that we see in our clinics are overuse injuries, deconditioning resulting in stiffness and possible muscle injuries, and where someone hasn't the great strength and support that is required for a certain activity, such as a throwing activity, and they end up with upper limb injuries, both muscular and tendinous. And sometimes the direct trauma, which cannot be avoided, ends up with certain fractures, such as to the foot or to the shin, playing football, for example. The prevention of sports trauma, again, can be split into things that can be done by the individual, and then things that can be done by the governing bodies. And for example, an individual may, especially in the off season, decondition themselves whilst they have a break, go on holiday, and do family things or do things that interest them away from their chosen athletic or sporting activity. As a result, when they return to their training, they do need to build up correctly and sequentially, rather than expect them to be able to be at their best from the first week back into training. Therefore, a good pre-season training program will be essential in preventing early season injuries. Other things that the athlete can do is that when they do have a minor injury, to report it to their medical teams, look after themselves and go through a correct rehabilitation process, again, taking their time, being patient until they are truly recovered. I've mentioned that sports governing bodies also have a role in preventing sports injuries, and this is true for many different sports. Once again, I focus on rugby, and we can now look at rugby union scrums, for example, and the rate of neck injuries to the front row has decreased considerably in the last 10 or 12 years, since rules are being brought in and modified each year to reduce the trauma that the front rows have. Also, the tackle practice has also been modified so that protects each player from direct injury as a result of poor technique. And these are examples that governing bodies in the sports I look after have made a very significant difference to the number of serious injuries that can occur. My advice to you as athletes, either recreational or professional, is prepare yourselves properly for your sport. Don't rush into competitive situations before you're ready. And when you are injured, let your teams know so that we can deal with your injuries before they become serious. Of course, in my line of work, I end up seeing those that actually have injuries that require surgical intervention. And if that is the case, once again, I ask you please to be patient, follow the rehabilitation programs, and in doing so, you have an excellent chance of returning to your pre-injury levels and continuing playing your chosen sport.